Kvedar, at the Center for Connected Health, I think you were familiar with mobile applications long before it became part of the mainstream. And I'm just wondering what is going on at the center today. What's the most, what's top of mind for you?
Well, top of mind is interesting how it's evolved, because it's really, our goal, of course, is to keep people healthy and have them engage with technologies in a way that they will use feedback loops to keep healthy. Mm-hmm. And so that means we have to find the right motivational sweet spot for each individual, and they're all different. Mm-hmm. So a lot of our work is in learning about that. How can we give you, say, a 5-question something, learn enough about you to start messaging you, and then as your behavior changes, as evidenced by your sensors, change those messages even more to keep you engaged, keep you healthy, keep you on the program. So that's a big one. And then the other big one is just how do we integrate all the genetic information that's coming down the road?
The genetic information?
Yeah, it's going to be really interesting to do. The intersection between genetics and connected health, which we're calling personalized prevention. Because it's highly personalized, and the idea is if I know you're at risk for diabetes, maybe I can catch you early on and keep you from getting that by giving you the right connected health program.
Mm-hmm. So your latest blog, your most recent blog, was about a project, I'll call it a project, called Wellocracy. Tell us a little bit about that.
Well, it's a really exciting, I have had the privilege over the years to watch our patients adopt connected health, and they find it very enticing once we get them on the program. Mm-hmm. And yet, if you look at the consumer, say, between age 40 and 60, virtually nobody knows about this stuff. And so Wellocracy is a series of ebooks and a community-building website to engage that community, to engage your regular citizens who have not yet caught on to the value of self-tracking and connected health, and bring them into the fold, teach them how to use tracking devices, how to use motivational tools like apps, and how to work healthy behaviors into their life in a way that isn't disruptive to their life. Mm-hmm. So we launched at the Consumer Electronics Show. Our first book is now at the publishers, so it's moving. Website will go live in a couple weeks.
And tracking could be habit forming, right?
Well, that's the idea.
That's the idea.
You know, and it will be habit forming as long as we keep that motivational part crisp.
So at the Mobile Health Summit, I'm wondering, I'm sure you've had a chance to look around, I'm wondering, of all the things that you've seen, what has struck you the most?
Well, there's always a lot of innovation, and that's fun. These pavilions are fun to walk around. You can spend hours walking around looking at the various startups, and that's always fun. And the other thing, though, that I think is probably a bit different this year is that we're seeing large firms like Aetna, who gave a very nice talk the other day on their strategy, but these large companies coming out with something that they're clearly making a big investment in the area of mobile health. So that's interesting traction. And then the other thing that I rather enjoyed was the things like the Open M Health, the idea that we can build communities around merging all these different apps and devices that are very specific to the individual. So if I use a Fitbit and a whizzing scale and something else, that I can get all that in one interface, and it makes sense.